even before the wife starts speaking, the husband goes like, "Arey, ye itni shant thi, abhi maine pen seedha nahi ulta rakha," so she starts getting worked up over that. And it is very frustrating for the ladies because they don't understand, why have I become like this? Why have I become so snappy or cranky?
You're watching Not Just Auntie with Suman Adepalli.
The reason for this conversation, and we are totally digressing from our earlier format of doing personal interviews, is because there is a significant percentage of our target group which experiences symptoms of perimenopause. Now, I want to talk to you about perimenopause because a lot of our TG, they don't even know that they are suffering symptoms of this. And I say this with experience. It is believed in India that we go into menopause only when we stop menstruating for about a year. Am I right when I say that?
Yeah.
But there are many symptoms which begin way before this phase occurs. For example, adult acne, and then hair loss, joint pain, and many such. In fact, I'm the wrong person. You're the one to tell me what kind of symptoms are there. So I wanted to speak to an expert, a gynecologist, to clarify these concepts, because I have gone through a significant struggle to find out what was happening with me. And I was constantly being told I'm stressed out. I was being told that, this is PCOD, which I'm not even sure I have. If you could throw light on this. So what is perimenopause?
So basically, like the word says, right, perimenopause is around menopause. It's the period around when you're going to achieve menopause. So perimenopause can basically last, I would say, anywhere from, there are females who go through perimenopause for around 4 to 5 years, to some lucky ones who have it only for like 5 to 6 months, right? So perimenopause is basically, I would like to say, like in the Indian women start around somewhere close to 44, 45, because we hope to achieve menopause by say 50. So you basically realize you're going through perimenopause when the most common symptom, I would say, is mood change and irritability. Okay. So there are these...
God save the men.
God save the men. So there are these couples who come, and even before the wife starts speaking, the husband goes like, "Arey, ye itni shant thi, abhi maine pen seedha nahi ulta rakha," so she starts getting worked up over that. And it is very frustrating for the ladies because they don't understand, why have I become like this? Why have I become so snappy or cranky and stuff like that? So that is one of the most commonest symptoms. Okay, then the other symptoms which a lot of people know about is hot flushes, is vaginal dryness. So because of vaginal dryness, you don't tend to enjoy having sexual pleasure, or don't tend to enjoy having sex as much, because it's the whole fun of it is gone because of the pain that you go through because of the dryness. And it's very easily solvable, right? So that is one. Then a lot of other things like hair loss, bone and joint pain, adult acne, like you said, but luckily adult acne isn't very common, but it's there. And also other things like, how do you put it? So bloating, breast tenderness, something that females have never maybe experienced their whole menstrual life, but now suddenly start developing hard breasts or tender breasts just prior to cycles, or severe bloating, menstrual cramps, menstrual irregularities. So there are people who don't get their cycles for 2 to 3 months, and they don't really go to a gynac because they're like, "Haan, ye normal hai na. Period jaane ke time pe it's going to happen. You're not going to get your cycle on and off." So stuff like that.
Okay, because you mentioned about the cycles getting elongated.
Right.
I've also heard from friends of mine is that they don't realize which is a safe period, and a lot of women get pregnant during this.
Absolutely. So like we gynacs say, the time that perimenopausal area is one of the easiest times to get pregnant. Again, like it was when you achieved menarche and stuff like that.
Right.
Because one, you don't know your safe days if your cycles are irregular. And two, you're pretty lax about everything. You're like, who's going to get pregnant now?
Yeah.
So you don't really take the precautions like you should. And that's true. It's very easy to get pregnant. So you do need to be careful. Like some people do find it a little annoying, when they come to the OPD. And the first question I sometimes ask is, are there any children? Like, no, how can it be? I've said, no. How it can be is my job. Did 1, 2, 3 happen? So then they're like, oh, really? And there have been a lot of patients who are pregnant and don't realize it. And so, yes, like you said, it's very easy to get pregnant.
Yeah, thanks for actually clarifying that, because a lot of these conversations actually are very difficult to have. In fact, the cultural and the taboos around menstruation in India and even Asia, many cultures, already people are not ready to talk about menstruation. And actually, it's the beginning of life, right? For a lady, it shows that she's healthy, able to become a mother. So there is a double stigma from whatever literature I've read, whatever I've seen myself through personal experience, through friends and family, to talk about menopause, simply because people feel that, oh, this is the end of my youth and this is the end of my sexuality. This is the end of my ability to ever be a mother, and so on and so forth. So actually, I request you to talk about why this phase should also be welcomed, because one thing is it's natural. So
menopause is something all women go through, right? All women go through menopause. It's a very natural phenomena. It is not my body shutting down, which is the thing which everybody actually believes. It is just where your body undergoes certain hormonal changes, and this is a routine thing. This is what should happen. There is a reason why we stop bleeding at a certain age. There is a reason why the body is made in such a manner that you do not need to lose that amount of extra blood that we do lose in those reproductive years. You don't need to lose it after a certain age. Now, the only problem with menopause is when you undergo these symptoms or you have these problems and you do not address them, or you take them as a part of life. I am going to suffer. It is meant for me to suffer. You don't need to suffer. There are a million things we can do to help ease out this whole process. And there are certain women who get menopause at a much earlier age. And when I say earlier age, I mean they achieve menopause at 40, 41, sometimes even in their late 30s. Now, those are the only women where we need to pay that extra attention, where we need to help them that little extra bit, because their hormones have, stopped a little way before time. I wouldn't say hormones have stopped. Actually, that's not the correct way to put it. But it's like their hormonal imbalance a little bit has crept in a little earlier than it should have. So the stigma of menopause, where now I'm going to lose my sexual urges, or I am going to not be a woman as I used to be, or I'm not going to be feeling I'm going to have wrinkles and stuff like that. It can be all worked upon, and there is nothing wrong in any of that. It is a natural process of aging, so it's just something we need to ease on to.
In fact, I would like to add on to your point, just to put the general audience at ease, the ones who are watching this video, is that the Indian National Family Health Survey, the latest one, it is actually, in the medical journals, 18% of married Indian women between the age of 30 to 49 have already experienced natural menopause. And when I say natural, again, to explain it, it is menopause not induced by hysterectomy or, medical intervention. A lot of the friends I speak to of my age group, okay, I'm 45, just to, I don't like to say this, but so they actually say that, oh, my mom menopaused at 40, so it's okay if I menopause at 40. But there are a lot of underlying health issues which are impacting or interfering in their day-to-day living. This is not the first conversation on menopause, but there isn't enough being done. Perimenopause is not heard about. I mean, people don't know that, maybe 10 or 15% of the symptoms start way before your period stop. So
They do.
is that, can you delay the onset of perimenopause and menopause, or it is already predestined?
So the thing is, menopause, 80% I would say is genetic, right? It's what is not handed down, but kind of. So if your mom or your eldest sister achieve menopause at a certain age, you are going to achieve menopause plus or minus 3 years around that age, the natural menopause, right? So you cannot really delay it, right? You cannot really delay your menopause, or you cannot push your perimenopausal symptoms. But what you can do, because menopause at this point of time in today's day and age is also a lot related to your environmental factors and a lot related to the socioeconomic status. So it is shown in a lot of papers, and frankly, we don't know the reason why, but it has been shown via a lot of papers that the females coming in from the lower socioeconomic strata do achieve menopause earlier than the people in the higher economic strata. We have still not been able to form a connection as to why, but that is one of the things. Environmental factors like, females who smoke are going to achieve menopause a little earlier than the others. People who have a lot of refined carbohydrates, people who are working in chemical industries and inhale a lot of chemical pollutants or toxins, do land up achieving menopause earlier than their age. So in these situations, like what we tell all the females in that particular age group is there is something called as phytoestrogens. Okay, so phytoestrogens is basically plant estrogens. Now, estrogen is one of the most important hormones in our body, which is what actually protects women and gives us good bone health, good cardiac health, good hair, good skin. So phytoestrogens are now found in vegetables like cauliflower, like broccoli, like soya beans. So if you tend to have these a little more, you're actually giving yourself a substitute of phytoestrogens, which has zero side effects. It's not like hormone replacement therapy. So yeah, you can delay those perimenopausal symptoms and menopause to a certain bit. You're like taking care of the environmental factors.
So doctor, since you mentioned that the lack of estrogen, as in, or the declining estrogen in the body, which takes care of skin health and bones and cardiac protection, is declining. So what can women do to ensure that they are fit? I mean, do you need regular checkups, or what is it that, I mean, you already mentioned that there are interventions that can help women who achieve it early, or, who are experiencing severe symptoms. So what else can be done?
So the thing with decline of estrogen, like you also mentioned now, it is cardioprotective, it is bone protective. So what we prefer is that if you start on vitamin D3, which is like a supplement once a week, you take that whole course. You start on your calcium supplements. Yes. You start doing a little bit of yoga, a little bit of exercise, even if it is a 10-minute walk around your block. But that little bit of exercise is what is going to help you protect your bones and prevent that osteoporosis or prevent those fractures which are commonly seen in women after they achieve menopause because their bone health starts declining. So by doing vitamin D3, calcium, exercise, walks, yoga, you're protecting your bones in a kind of manner, right? Increasing your protein intake, even in the whether it's non-vegetarian or whether it's in the form of cheese, soya, paneer, all these are very high in protein. Again, help with bone health. Now, when it comes to cardioprotective, in general, when you're taking care of your health by exercising or by doing yoga, you're in general taking care of your whole body, your whole system. So your cardioprotectiveness is there. you obviously start to, consuming less of refined foods, which I think everybody has become very aware of. So it's not only menopause related in general. Yes. Taking care of your health from the age of 40 really helps ease out the process overall. So decreasing your refined carbohydrates, increasing the amount of dark green leafy vegetables. So that increases your iron intake, but it also increases your phytoestrogens, which again help you. You do have to undergo regular health checkups. So it's not only perimenopause, but after you cross the age of 40, very, very few females, unfortunately, know that they have to undergo checkups like pap smears, like mammograms, like mammographies. A lot of women actually believe that once you attain menopause, you don't need to do any of these tests. Those problems are only there during your menstrual life, which is not true. After you achieve menopause, doing a pap smear, doing your mammos, doing a regular health checkup with your gynecologist once a year is all that is required.
I've asked you this question in the past, is that a lot of women believe that if I take a hormonal replacement treatment, which is what needs to be done if you have menopaused early, or if you're experiencing severe symptoms, it is believed to cause cancer. So again, maybe this was true many years ago, and now there are advances in medication. So could you just touch upon this as well?
So hormone replacement therapy is something where we used to use it initially as a replacement for females who undergo not natural menopause, but where for some reason we do have to undergo a hysterectomy and we need to get the uterus out and the ovaries out at a much earlier age than when they would have achieved the menopause. But hormone replacement therapy is not given to every female who achieves menopause even at 45. It's not a thing कि 45 पे menopause हुआ तो please give them hormone replacement therapy. No, that's not how it works. We undergo a battery of tests and we sit down with those females to actually figure out if hormone replacement therapy is required. Because yes, ultimately it is hormones given to the female externally, which her body has stopped producing for a certain reason. So people on HRTs have to undergo a battery of tests prior and post being on HRT. Whether it increases the risk of cancer, not really. Studies are actually still going on HRT and breast cancer and HRT and ovarian cancer. But normally HRT is given when we have removed the ovaries in the first place. So
okay, so there is nothing to worry. And I've also heard that there are a lot of now transdermal medications which do not cause these kind of symptoms. Am I right in saying that?
Yeah.
Okay.
So you do get transdermal patches. Unfortunately, it's not as easily available in India as it is available abroad. And we do not prescribe it as much because we haven't had studies on Indian women. So what we need to know is that a lot of studies are done on the Western culture and they achieve menopause at a much later age than the Asian women. So when we talk about transdermal patches or we talk about HRTs, we need studies on Indian women before we actually go ahead and prescribe it and take it as an over-the-counter medication.
All right. In conclusion, Dr. Tushna, I just want to ask you that what are the positives of this phase? Because menopause is inevitable, like Thanos.
Absolutely.
And women are going to experience it. And I think women are uncomfortable even when they menstruate the first time. And, so could you throw some light on why we should welcome this phase?
So menopause is also a phase which you should welcome, like you said, because, okay, so let's look at the positives, right? Menopause means no periods, no cycles, no carrying a pad in your bag every day because you're not sure when you'll get it. There are a lot of women who have these heavy flows, painful cycles, who PMS, right? So no more painful cycles, no more heavy flows, no more losing blood, no more PMSing, no more having those menstrual related headaches.
Anemia.
Absolutely. So when you lose a lot of blood, there are a lot of females who tend to develop literally anemia every 2-3 months because of heavy flows. So they can start taking care of themselves. There is build up their hemoglobin. You can start having sexual relations without having the tension of the same days and getting pregnant. You can start taking care of yourself now. Most importantly, you don't need to plan your vacations, your pujas, your temple visits according to your cycle and take medicines to prepone or postpone them. So many positives here out of achieving menopause. You're a woman, and it's fun being one. We have so many things to look forward to in our life. Genuinely, it's a good phase. It's a phase where you crossed over, and now there is no worry. Now, abhi sab kuch theek hai. Now I can take care of myself, do everything that I want to do without worrying about whether I'm going to stain myself or not, and just enjoy life. It's good.
Thank you so much. And like you said, that if you're suffering symptoms, something can be done about it. So there's no need to
Absolutely.
suffer. And thank you so much for this conversation. It's been fabulous as usual talking to you.
Thank you, Suman. Thank you so much for having me.
You're watching Not Just Aunty with Suman Adepalli.